Greetings. I would like to give our community a quick update about where we are with our clinic resumption plans. Right now, many of you understand that the state is in phase 3 of the phased opening. We're stuck right now in phase 3 since we anticipate potentially a surge in cases as students return to Boston and as the flu season and fall come upon us. Tufts University itself is welcoming students back to their campus this week, and that will go through Labor Day so that they can resume in-class and in-residence kinds of activities for our main campus. The dental school is well into phase 2, and I hope that the plans in September will allow us to be at 50% capacity on all of our floors. As you can see, we've met many of the check marks that we needed to meet in order to move into phase 2. We have limited testing for our patients. We continue to do screenings and temperature checks for our patients, but have stopped temperature checks for our patient-facing faculty, staff, students, and residents, since they now are being tested for COVID-19 every week. We maintain our social distancing and mask wearing protocols. And as you've seen, our PPE and other protocols are well in place. We currently have a stock of 90,000 respirators on hand. So we believe with the volume of activity now ramping up, that we should be able to go well into the fall and winter and continue to build that supply, so PPE will not be a concern in terms of potentially having to shut down. We aspire by after Labor Day to have at least 40 to 50% of each of our clinical spaces open up for clinical practice. In phase 2, many people have been involved in continuous space development. Our HVAC systems have been upgraded, and there's been a little bit of a slowdown simply based on some of the things we found in our HVAC system. You'll notice many of the clinics now have the plexiglass in place, and each chair has our suction updated to mitigate aerosol spread. We've reviewed and refined our protocols around infection control. We've reviewed our schedules, our staffing needs, and we are monitoring the health and safety of all in our community with our surveillance and contact tracing program. As of this week, there were 2,000 plus individuals from the Boston Health Campus that were tested for COVID-19. Here you see some of the pictures on the HVAC work that had to be done on the 5th floor in oral surgery. You can appreciate the ceilings that were opened up, all of the upgrades that had to happen. And here, after all the work is done, you can appreciate the plexiglass that has been put up in these spaces. So we anticipate the 5th floor will be completed by August the 28th, and the upgrades on the 3rd floor will be completed by September 7th. We anticipate oral surgery moving back to their space the week of August 31st. This will allow emergency on the 2nd floor to move back into their space on the 2nd floor that week. GPR and AEGD, we aspire them to return to their space on September 8th. The plexiglass upgrades, as many of you can see in the clinic, are being completed in the next week. And we aspire to increase our DMD activity on the 2nd, 3rd, and 4th floors, beginning the week of September 8th. Again, we're pretty sure we can meet this, but if we do find any issues that are unanticipated, we may have to push this back by a few days or a week. Just to show you the activity that we anticipate on the 4th floor, starting September 8th, we will have a total of 21 to 22 chairs that will be available for our DMD program, going from 8 up to 20 to 22, an increase threefold, giving us 50% use of all of the chairs on that floor. Here you see on the 3rd floor the return of the GPR AEGD programs to their units, and the DMD chairs as well, allowing us for up to 22 chairs to be used on that floor. And on the 2nd floor, again, you can see about half of the chairs being devoted to DMD activities. So once we get to about 40 to 50% capacity, you can see the number of chairs that will be used on any given floor, the number of faculty, staff, students that will be permitted per floor. And we look forward to moving ahead now that all of our safety measures are in place, with allowing our students and residents to ramp up their activities and obviously to treat our patients. Thank you very much.